I want to spend a few minutes now talking about reliability. Yes, we are all highly trained professionals. Yes, we're totally committed to our work. And yes, we work in complex systems where quality and safety are fundamental principles. But there is something about a complex system that means we have to think about the reliability of each step in our work, not just put them all together and think that we're doing a pretty reliable job. High reliability is something that is achieved through thinking quite systematically about the steps, minimizing them as much as you can, but most importantly of all, making sure that each time that step is carried out, it is carried out to the highest possible standard, so that each step in turn then gives a really high quality experience and outcome, clinical outcome for the patient. So I'm just going to explain now some of the maths behind this. And you may want to watch this video a few times, or indeed look a few things up about it online, because sometimes it's hard to get this first time. So let's take the example that we were talking about earlier. We were talking about somebody that comes in with a diabetic ketoacidosis. Now, of course, there's a process we go through when a diabetic patient comes into hospital. First of all, we measure what their blood glucose is. Secondly, we want to know what their ketones are. We may want to do blood gases too, but either way, we've just put ketones in for here. There's an escalation process we've worked out. At what level we have to call the registrar, at what level perhaps we call the consultant or an ITU consultant because the patient needs intensive care pretty quickly. And then that person has to turn up in a timely way and the activities then have to happen. There's no point wanting an ITU bed if you're going to have to wait a few hours for it to happen. But we kind of condense this into 4 steps, and you'll see why in a minute. Now, this particular team looked at the last 5 cases that had been admitted with out of control diabetes, and they looked at how often they had done the BM sticks as soon as the patient came in. And you could see that it wasn't all the time. In fact, actually, it was only just half the time. Sometimes it was delayed, and sometimes it actually was overlooked. Secondly, what about ketones? Well, reading the ketones is obviously you have to take the measure, but you also have to make the right assessment. When they looked at it, sometimes that was not the case, and only half the time was it read properly. You might want to understand how could that happen, but there are many ways that can happen. Then, was escalation appropriate? Well, yes, 2/3 of the time, but 1/3 of the time, either the other person's bleep number wasn't known, the rotor on the wall was inaccurate, the person didn't answer, and you had to bleep somebody else. And did that person turn up on time? Hardly ever, because the communication system didn't always make it clear that we needed you now, or we need you within the next 30 minutes, this patient is deteriorating, etc., etc. Well, that's a pretty sanguine set of data, but really all it does is show us that this system is unreliable in different ways at every step of the way. Now, as we've already pointed out, for a really optimal outcome for this patient, all those things have to happen properly. So here is a table that shows you that if you've got a 4-step process and you are 90% reliable at each step, then the overall process is still only 2/3 reliable. Now you might ask, well, why is that? Well, it's because each step, the error in the previous step is multiplied by the error or the unreliable step that comes up next. You need over 90% compliance at each step to get anywhere close to good enough. And in our case, we've got 50% by 50% by 64% by 20%, which actually gives us a 2% overall reliability, which is not good for the patients. Here is the same example where things were worked on and improved using human factors grids and effort and consideration and redesigned the process. And now we're looking at 93% reliable. That's the way to get children seen fast, get the right diagnosis, get them to the right destination, and give them the best outcome that's possible.